Uganda is a blessed country with a very high population. We currently have about 34 million people as citizens of Uganda. However, amongst this vast population, we currently have only about 50 orthopedic surgeons. That means each orthopedic surgeon on average has to take care of roughly close to 1 million people. Hello everyone, my name is Dr. Edward Chironde. I'm an orthopedic surgeon at the Sign Clinic in Mulago National Referral Hospital, Kampala, Uganda. Day to day I am faced with the challenge of treating patients who have been subjected to musculoskeletal injuries, mainly following road traffic accidents. The burden of trauma and musculoskeletal injuries in Uganda is very high. Its incidence is equally as high as that of other infectious diseases like upper respiratory infections and malaria. Despite this high burden of disease, not much attention has been paid to trauma. The sign nail has made a big impact in this regard. First of all, because it's a free nail, so the patient does not incur any cost. The typical economic status of a patient who receives the sign nail is usually a low-income earner. These are patients who earn slightly over $1 a day, and for this reason, affording an implant that is more than 10 times what they earn in a day is something of a dream or a miracle. The provision of such an implant to these patients is very critical because they are the backbone of our economy.
Go! Go! Hey! Go! Break!
In this country, this is the most depressed area economically. The work that is available for people here is in the fields. It's basically tilling the fields using rudimentary machines or horse. And you see how agriculture in this region is weather dependent. It's not really a good area to be in. I'm Dr. John Ekure. I'm an orthopedic surgeon. I'm also the CEO of Kumi Orthopedic Center. We've been in operation for the last 5 years. We've had a turbulent history in Uganda. And in this place, I lost my own mother who was taking care of us, who was paying my school fees. When I lost her due to the war, she was killed by armed people. When she died, I had almost no future. My future was shattered. The few people in this area, poor as they are, traumatized as they are, kept me at school. They worked hard to make sure that I finished my school. They knew my ambition was to become a doctor. And I thought I needed to pay back when I finally became an orthopedic surgeon. And that's why I brought back this clinic here in Kumi, because I want to serve the local community here, and I want to serve other people as well. Road traffic accidents are a menace, are terrible, and they're like an epidemic. They are actually going to pull back our economy. They are actually going to pull down our country instead of helping lift it up. Boda is basically motorcycle taxi. These are the same group that injure others, and they also get injured, and thousands of them have died every year. Thousands of them have been maimed, and some of them have gotten disabled, some of them have lost limbs. Traffic accidents are causing poverty through disability, through maiming, through incapacitating families and people. So it's something that needs to be worked on, needs to be prevented here, because the consequences are really dire.
I was traveling from Kampala on Saturday with my colleagues were in a super custom, and then we lost control around Awoja and we plunged into the water. My name is Juliet Apieno Atai. I'm 30 years old. There are people who carried me off the accident scene. My leg was broken and my fingers were crushed. So the next day in the morning, I was rushed to Kumi Orthopedic Center for immediate attention. Yeah, when I saw the x-ray and I saw the femur was broken, I was worried that I wouldn't walk again. Thought I was going to they're going to amputate my leg, or when I recover I'll walk while limping. And yesterday at around 9:10, I was taken to theater and the surgery was done, I think perfectly well. According to the doctor, is it a metal something that was fixed to join the bones together?
This is the standard side nail. It's a solid nail, and we're going to use it to fix the distal third femoral fracture of this lady Juliet. Got involved in a motor vehicle accident.
I saw it today on x-ray and it's perfect. At least the bones are aligned. Though still weak, I have to keep practicing how to move, but I know by next week I'll be back on my feet. I have one daughter. How I would take care of her, how I would carry her without a proper hand, and I would move with her around without a good leg. But now that I can walk, I think we shall even start running together.
Before we started using sign implants, it was like you're going to keep somebody for months in the hospital. Now it takes a few days and someone is back at home with their family, and that helps save them from further poverty.
The current implants that are available will run out in just a few months or weeks. So the answer to that question, whether we have enough implants, is a definite no. We need more implants.
Accidents happen every day. Can be prone to any accident when you least expect it. And with these kinds of materials for help, at least you'll give people their lives back.
This group has touched lots of lives of so many unable people in the world, and they're giving them the ability to live full lives again.